Okay. Good afternoon, everybody. My name is Fred Christian. I am a disabled community activist, the founder of the. Let me hold on. Sorry about that. We're going to start video. Good afternoon, everybody. Sorry about that little hiccup. My name is Fred Christian. I'm a disabled community activist and the founder of #Impact, a social media 501c3, which we today are here to talk to you about healthcare, Medicaid expansion, and why you need to care about it. Part of this is we have a wonderful guest named Anna Christina from Acosta from Florida Decides Healthcare. We have a few other guests coming on today to discuss this with you, but we're here to talk about the petition, what to do, how to do it, and why to do it right. So our agenda for today is very simple. First, let me open us in prayer. Lord, please bless these wonderful participants, bless everybody who's coming, and please let us get this healthcare initiative moving forward. Let us be able to get everything done with what we need to do, and just open doors for us to get the million signers by February. Use us to do great work for you in the blood of Jesus, name of Jesus. In Jesus' name I pray. Amen. Okay, folks.
Amen.
So let me just introduce everybody. We got Collective Sisterhood, Miss Joey. We got Anna Christina from Florida Decides Healthcare. We got Brian from a few organizations. We got Susan Kennedy Nanton so far from Bullets for Life. We hopefully will have Tawana Akins and Amy Rodriguez on in a few minutes. And we got a few other guests that are going to come on just to learn. So we're ready to go. I'm going to try to change this up a minute or so. Okay. I want to just start this with an icebreaker question. I want to ask each of you want to chime in with us. Why is having healthcare important to you? Who wants to go first?
I can go, Fred.
Okay.
Healthcare is good because when you are well, you can stay healthier and do more things and be productive and be happier and live a longer life when you have access to healthcare. And that's why it's so important, because a happy mind and a happy body is what we need to stay alive and well.
Okay. For those joining us, we are going to be doing I Asked the Question to Miss Joey. If anybody else would like to go. Anna Christina, I hate to put you on the spot. Would you like to participate in this?
No, absolutely. Yeah. I mean, healthcare is such a basic human right, and it's so connected to all of the core issues that we deal with in community, right? I can't think of a single issue that doesn't somehow tie back to healthcare. So this is just very fundamental and really feels like a no-brainer.
Okay. Brian, can you speak on this right now, or are you still on mute? I'd like to ask you, the question was, why is healthcare important to you? Okay.
I can answer.
Okay, go, Sue.
Okay, so healthcare is important to me, especially you just never know what's gonna happen in life, right? Life is life in every single day. And like our sister on this just said, Anna, she just said it's our right to have healthcare. You just never know what can happen at any time. Accidents are happening every day. People are dying every day. I just accidentally chopped my finger off, broke my bone, with just a snap of a finger, anything can happen. And it's important that, thank God that I had some kind of insurance, because it's expensive, especially if you're a nonprofit or you don't have a job, a 9 to 5 that have insurance. It's important to have health care, because you just never know what's going to happen. If I did not have something, there's no way I could afford to go to therapy every other day and have surgery and so many other things that I need during this time, right? So, and it came out of nowhere. Suddenly, anything could happen suddenly, right? So it's important that it's our rights. Everyone should have the right to health care, because you just never know. This is our life. Life is happening, y'all. It's happening every day. And you just never know when you're going to need health care.
Susan, could you tell them real quick what you do with Bullets for Life, please, for a minute, to explain why this is important?
Bullets for Life is a nonprofit organization that we are anti-senseless gun violence. Like, we're tired of seeing our children dying by gun violence, seeing our community dying by gun violence, period. So we're an organization that fight to save lives from bullets. What we do, I started 10 years ago after a 6-year-old boy was killed by a stray bullet. God gave me a vision to go get bullets off the street. So what we've done for the last 10 years is take off the street over 30,000 bullets came off of the street of not just Florida, but nationally. We go into inner cities, we go to wherever we go, we just go all over and ask the community to donate a bullet. Every bullet you give us, that's a bullet that will never take a life, because what we're going to do, we're going to take that bullet and repurpose it into something beautiful that you can now wear, knowing that you have saved a life. We also do workshops in school called the No Bullet Zone workshops, not just in schools, but anywhere that youth that have youth program. We go into the streets, wherever we go to where there's our kids are, and we're speaking life into them by asking them to dismantle bullets, right? And letting them know that their life is worth more than a bullet. So these kids are destroying bullets and walking away saying, I save a life today instead of I take a life today. So that's what we do, pretty much a little bit of what we do. We just speak life into a community that's already bleeding, but also saving lives and honoring the lives that's been lost by this act of violence, right? And we know the mass shooting just happened. Kids are about to walk out of school tomorrow. So we just want to support their walk and try to keep them alive. Kids should not be going to school and die. You know what I mean? Kids should be able to go to school and come home after school, but they're not coming home. They're being killed in school, and this should not be happening. And it's been happening for way too long. So we fight. We're just fighting to keep our children alive. You know, I'm a mother of 3 sons, so I gotta go hard. I go hard for my community. I go hard for my family. Unfortunately, I just had this incident that held me back. I just had to be still for a moment, but I'm still in the fight. Right. So that's what we do.
And she's joining us in the fight for Medicaid expansion because she was one of the people that was in the gap off and on through her life. This woman gave up a $50,000 a year job to do this. She didn't have to quit a great lifestyle that she had, but God led her, and she's been a great servant to the community in this state and this country. This Susan has had this bracelet, which I'm going to show you, not this exact one. There's an orange one that she donated to Nancy Pelosi through Representative Frederica Wilson. She's had several famous people wear her bracelets, but she's also a healthcare champion now too, because we really need to do both gun violence and healthcare. Because part of the reason I did the healthcare too was when I was uninsured. I'll tell this story real quick. It was a nightmare for me because I used to say to myself, I'd see all this gun violence on TV. If you're in the wrong place at the wrong time, I used to say, what happens if I get shot, God forbid, or someone like me gets shot that has no health care? What do? Okay, the hospital will cover the charity. But what do you do with the outpatient therapy, the physical therapy, the OT, and the mental health therapy? Because there's going to be trauma involved. You don't need the trauma of double trauma of being injured, shot, whatever, even in a car accident or anything like that, and having a double trauma of a huge hospital bill or a huge medical bill you cannot pay. That's part of this too. Medical debt's a key part of it. I invited Ideal on. I'm hoping she can still join us. If she can't, it's okay. Hopefully in the future she will. But we're going to do what we have today. And I want to just tell my story real quick. I'm doing this because of a labor of love, folks. I went 30 years from the age of 16 to the age of 50 without health care. I didn't get it until I got my disability. And I'm grateful I got it because it saved my life because I'm diabetic now. Yes, I made some bad food choices, but I had asthma and all kind of stuff. I can remember begging people in the waiting room, my dad begging people when I'm in the hospital choking, trying to breathe at 16 years old to pay a bill. No kid should go through that. None. None. And yes, all y'all are talking about the community violence. It is a disease and it is a disorder. And we need to unite on the gun violence front and on the healthcare front and also on the housing front, Ryan, and get this done. This is a three-pronged issue where we have to get it done as a unified unit. If we come together, which is part of tonight's mission, getting clergy, getting other folks to do this, to help us with these petitions. So hopefully we can do this. So without further ado, Anna Christina, I'm going to let you explain the process, please, about the petition.
Fred, you had a comment in there by Kia Marshall in the
Okay,
chat.
I'll address it. Let me just address that right now. Sorry, Joey.
You have a couple of great comments in there.
Okay. Okay. That part of it okay, Kia, let me explain to you what we're doing. Medicaid expansion is for the people that have no
No,
health
she
care at
made,
all.
she made a comment, Fred. It says,
Mm.
I've seen clients unable to receive treatment because some of them not being in network with marketplace insurance based
Right,
on where they
right,
work at.
right. That is
Yeah.
part of this too.
Yes,
That's
so,
part of this too. That's part of the system. That's part of this with the Obamacare part. We're gonna fix that eventually. Right now, we're trying to get these petitions signed so we expand Medicaid for the people that don't have it. Because you guys as young social workers have to understand there's probably gonna be right now there's 1 to 3 million people potentially, and some of them are in the marketplace ACA. They're going to lose subsidies that might go back into Medicaid. And there's no Medicaid expanded in Florida. If you make below $15,000, you're Medicaid eligible, actually 13.5. However, they've reduced the quotient on that to about 12.5 or 11.5. They're making it harder to get Medicaid. They made it hard to get these petitions done. Anna Christina will tell you that. But we do understand about the marketplace, and there have been a lot of people complaining about that, and it's a relevant thing because not everybody can go see their doctor they want to go see. Not everybody's getting covered, and that's going to be addressed. First, let's get this done with this petition because we got 10 states that don't even have health care for people. We're going to go from 1 million to 3 million people without it. I'm sorry, I'm trying my best. I really am. And I understand what you're saying, and we do need to address that. We do. We do. And unfortunately, we were going to have somebody from Florida Decides Healthcare on today, but um, she unfortunately could not make it, and a few people from Catalyst could not make it. However, we will be doing a meeting in 2 weeks, and we invite you to come on and please put that concern in the chat for them so they can address it.
Perfect. Thank you. Because a lot of the people with those marketplace insurance have applied for Medicaid and everything, and they get denied, and they have a serious ill condition, which I'm not understanding sometimes why they get denied. I was recently with oncology patients at the University of Miami, and I saw a lot of that happen and leaving them and their families to try to figure out what can be done for them. So that's why I mentioned that.
1 second, folks. I'm trying to multitask here. I'm sending someone the Zoom link so they can join us if they want to. Okay, I'm back. Let me just hit the button for my video to come back. Okay, so we had a great discussion on this. So Anna Christina, I'm going to throw it to you now so you can tell us about
You
the
just
petition.
right right before you go on, Kia was saying something. I don't know if you heard her. You went on the other line. She was explaining why she asked that question. I don't think
Okay,
you
I'm
heard
sorry.
her. Yeah, before you go on to someone else.
I'm sorry, Kia. I'm sorry. I wasn't trying to be rude. I'm trying to multitask here.
No,
We know, we know.
it's perfectly fine. It's fine. I was saying that yes, a lot of them have those marketplace insurances like Oscar, where a lot of people are not in network with because they just don't want to deal with them, or they say that the pain part is the problem. I recently worked with oncology patients at the University of Miami where they would apply for Medicaid and everything and get denied, and they have serious chronic illnesses that they should be approved for, but they're still denied. So a lot of them are left, and their families are left to try to figure out what can be done for them. So this is something that's really concerning, and I like that you guys are doing this because it's continuing to be an issue every day, even with those who have jobs. For example, for me, I have a job and I have Florida Blue Shield, Blue Cross, but the copays are ridiculous sometimes. So it's still like a major issue all over. That's all I had to say.
That, that's part of what we're going to do too, because this is going to be addressed. From what I understand, the plan is going to be once we expand Medicaid, then we're going to take care of that problem because even with Medicaid, you do have to pay copays sometimes for stuff, dental, outpatient stuff. You do have to pay copays. It's not like it's, let me let these people in. Oh boy, let me see. I have to go do this. Hang on a second. I got to figure this out here. Whoa. Okay, one person's going to join us right now. Before we get to you, Anna Christina, hang on a second. I want to bring on a person right now who's going to talk about the Oscar situation, guys, in a minute, if she can come on. Okay. Amy, can you come on for a moment? Are you ready? Okay, when she's ready, she'll let me know. This lady had Oscar, like you said, and she had an issue and she's diabetic. So this is not just the people you're hearing about as a social worker. This is people working a lot of other jobs who are having this problem. She switched out of it, but I want her to tell you guys what happened with that. Okay, she's getting on in a moment. Let's just hold up here. Ooh. Hi, Amy. Thanks for coming on.
Can you hear me?
Yeah, we can hear you. We can hear you.
Can you
Listen.
see me?
Yes, we see your beautiful face, don't we, Joey?
Well, I don't feel that well
Yeah.
right now, so I'm
Yeah.
sorry.
We see her beautiful face.
Okay. Amy, this is Devin, and Devin was pointing out to us about Oscar because she's a social worker with Miss Joey. She's one of her interns, and she was talking to us about how Oscar was stiffing some of their people. Devin, can you just really quickly bring
That's
Amy
Kia.
up to speed?
That's Kia.
Oh, Kia, I'm sorry.
Devin is
Kia,
also an intern, yeah, and Violetta.
okay. Okay.
And I.
Kia, can you please bring Amy up to date real quick in about a minute about what you were telling us about?
Yes, of course. Hi, Amy. So I was explaining that recently I was working with some oncology patients at Sylvester Cancer Treatment Center, and not well, most of them, a lot of them have like the marketplace insurance, of course, and some of them have different ones. But one that stood out to me primarily with the patient that was severely ill, I mean, bedbound, had Oscar, and he was denied services. I couldn't even find somewhere for him to be placed or anything. So it really kind of like, had me like, oh my gosh, this is bad. This is something that's like literally happening in our community and actually happening to everyone, no matter the age range today. So that's something that I had just put into the chat that was very concerning too, because they apply for Medicaid with chronic situations and then they're denied. So that's just to bring you up to speed of what I was talking about.
Okay, she was talking about Oscar being a primary one. Amy, can you maybe tell her about your little experience with them or what they did to you, please, for a minute?
Oh wow. Huh. Well, and I had Oscar for a year. I'm a type 1 diabetic. So unfortunately, I went without health insurance probably about 5 years before all the commotion with the marketplace insurance began. First, I had Bright Health, which wasn't that bad. The copays for medications weren't that bad, they weren't that high. Then Bright Health went out of market and they left the state of Florida and went back to California. So all of their patients who had Bright Health had to find another health insurance before the marketplace time period ended. So I was put in Oscar by one of the insurance agents. So Oscar, at first, when it came to basically PCP appointments or medications that were genetic and things like that, they weren't that bad. But when it came to insulin, um, glucose sensors, and insulin pumps, horrible, horrible. I spent several times I had to buy my own insulin and one bottle of Novolog or Humalog with Oscar was $279. That was my copay. And they didn't cover a lot of the supplies for the insulin pumps. I mean, they had me going back and forth with a war with them for maybe about a year. And every time I spoke with them and spoke with the customer service and explained to them my situation and explained to them, listen, I can't, I'm a sole provider in my home. I have, there's a kid, a child, a minor. plus my daughter, you know, I can't afford to be paying $279 every month for a vial of insulin. Their response to me was, well, then you should have gotten a better premium, that I should have paid for a better premium. So basically, with Oscar, I don't know about anybody else. My experience with them was horrible. I don't recommend Oscar to anybody. And every time that I see someone who has Oscar and they speak kudos about Oscar, my skin cringes
Mhm.
because
So
I can't. I
let me,
tell myself every, huh?
I was going to say, let me go ahead and introduce you when you're done. I thought you were finishing up. Let me introduce you because I want to tell your
Oh,
story because your story is very relevant for why we do this and why I'm a partner with
and
you
I'm
as our
still, I
co-founder.
mean, to be really honest, now, you know I'm grateful and I'm blessed that I have insurance through my job. But that this year has become an issue as well, because I was on an insurance prior to the one that I'm now, that covered covered more than the one that I am on now.
Right.
So
Because,
ultimately, at the end, it's basically for money. It's for profit.
right,
They don't
right,
care about the quality of health of any patient. They only care about the profit and the money they can make out of that patient.
right.
And doctors, some doctors are good at, like my doctor, the one that my primary care physician and my endocrinologist, they're pretty good at making letters and trying to push the insurances. But you have doctors out there who they're not willing to do anything for their patients. And that's where the problem lays.
Right. So if you think about this, you went how many years? What was it? 5 years without healthcare in between when Jen and Stephanie
I
aged out
went
of the.
Yeah, I went 5 years without health insurance.
Yes, this is why we expanded Medicaid. This is why we're here today to show why we want to expand Medicaid and put this on the ballot. This lady, I wish we had the picture to show everybody of you holding the sign for Jen. This lady has, my dear friend has went to Tallahassee to testify before we got this beautiful ballot initiative done. She went to Tallahassee to testify several times. She participated in protests. She went everywhere she can. Her daughter was a, her daughter was a, profiled in an article for the Washington Post, treating chronic illness with cough syrup, and the Miami Herald with a lifetime of respiratory illness. So she's been, she's pretty much got a lot of chops on this, and I'm gonna let her share a story in a minute. Let me just take this question from Devin real quick.
All right, hello everybody. So my name is Devin. I've been working in on the medical field, the medical sector for the past 20 years.
Mm,
Started off at University of Miami Hospital. Went to several different, in between, but my longest rant has been with Jackson Memorial Hospital for the past 12 years. Um, I started off in the finance department, and what I can say is that I just wanted to add to Kia's um to what she added to the group chat. And what is it? Maria?
Maria's
Maria,
fine.
Amy.
yeah. And
Mm,
from what Maria was saying too, insurance companies are the biggest scam artists, right? And I know that, so I've worked in our preoperative department for 9 years. I worked in a pre-testing department where we would get patients ready for surgery and stuff like that, and just getting all of the pre-ops and speaking with the anesthesiologist. It was always a pain when it came to the insurance part, right? So, like I said, I started with finance, so I have experience in finance, right? So, just working in that preoperative department, seeing patients who need surgery, Oscar and Humana and just a few other insurances always stood out because it was Oscar insurance was, to me, it was horrible. Yeah, they wanted to start so everybody can get, healthcare. But when it came to Oscar and all this other stuff, some of these patients, their co-pays was $5,000, for surgery and $2,500 for surgery. And it's almost insane because how could you charge, this amount of money when these are the same people that, can't afford insurance. Some of these people are paying $40, a month for this insurance, but
Right.
when they really need it, for surgery aspects of it, um, they can't afford they can't afford the surgeries and stuff like that. So I just kind of wanted to add that to that, that insurance companies are the biggest
Right.
scam artists, and at some point right now, it's like it's one of those things that you just get used to, and it's almost like you can't even get around it. It's like
Okay.
it's almost no way to get around it. Thank you.
Devin, can I ask you a question real quick, please?
Yeah, go ahead.
Okay, you did the billing. How do you address the uninsured people in your population that come to you like I did, like Mariami did, like several of us did? How do you address them if they don't have a J2 card? If they do not, as our friend Brian has pointed out as a resource, the card through Camilla's house or any other thing, Jesse Trice. How do you address them? Do you offer them anything? I mean, if you're dying and you need surgery, what do you do for these people? That's why I don't think anybody really explained to you. We're here today, sir, for Medicaid expansion to try to get some ballots for this ballot initiative so people have health care that don't. Because potentially in the state, right now, we could have 1 million right now without it, and 3 that could potentially with the Obamacare cuts and everything the Medicaid cuts have 3 million people in Florida alone without health care by the end of 2026. This is dire. This is nothing to play around with. So I just want to ask, how did you deal with it? And, uh, are you willing to help us with this noble cause?
Addressing the situation to patients, it's like it's a sad truth because honestly, you do have to tell the patients, really what it is. Fred, you just mentioned about the JO2 card, right? For some of you guys who don't know, a JO2 is a Jackson card, right? We have different aspects of it. It's a J11, which is for homeless people. A lot of people would go to, like you said, Fred, people will go to the Camilla's house or different resources like that, and they would, claim that they're homeless, and just so that they can bring that official letter from those facilities to, get healthcare insurance. Right? There's always ways around certain things. JO2, usually our patients will pay $40 for whatever services. Um, JO3, it'll be what, $70 or something like that, and JO4, it'll probably be 80 or $90 or something like that. But it's ways around certain things, and unfortunately, even with the Jackson cards, there's still some surgeries that don't cover everything. Just like a normal um, insurance company, right? I've worked at Broward General, who offers the same thing. I worked at Memorial Regional, which offers the same thing. But it's a sad truth. You just have to disclose that information to them that, hey, listen, you know, there's just no help around it. I've seen nurses, I've seen, my coworkers just try to pitch in, when it comes to these deductibles because there's nothing else that we can do.
So you
If you
see
can.
what we're trying to do. So you see what we're trying to do today with this Zoom and what we're trying to do with this petition. So you don't have to pitch in anymore. So you don't have to do like Mariami did and do a GoFundMe, like several other people I know have had to do GoFundMe's for medical. If we get this expanded on the ballot next year, we will have a lot more people have access to insurance, and we're going to have more control too, because Medicaid is a federally regulated program. They're going to have more rules on it, and they can't pull a lot of the junk they pull in the ACA, which is good. We'll get to the ACA. I can't badmouth the ACA totally because it has saved people's lives, including people I know, but it needs a lot of work, in my opinion. And because of the ACA, we were able to expand Medicaid too. And 40 or 50 states did, and it's successful. Florida needs to be one of them. So, Amy, do you want to chime in anything about your experience being uninsured, or Jen, real quick?
Well, with me, like I stated before, I was 5 years without any health insurance. Jen, my daughter, she lost her health insurance, her Medicaid right after she had lung surgery. She had lung surgery in May 4th of 2012, and she hadn't even turned 18 yet. She was only 17. She hadn't even turned 18 yet, and they took her Medicaid away. So she went without insurance as well for a while. I advocated, like Fred said. I went to Tallahassee. I went as far as Washington D.C. and I pleaded and advocated for her, advocated for everybody like her, like myself. Because having health insurance is not a luxury; it's a basic need. Having healthcare is a basic need. I Everybody should have healthcare. Nobody should in this country, as much money as there is in this country, we should all have healthcare. You know, um, and at this point right now, we're fighting for her to keep her Medicaid now because they want to take her Medicaid away. Um, my other daughter who lives in another state, she doesn't have Medicaid, and my grandson has kid care because in their quote she was $2 over their margin of income, so she doesn't get any benefits. Neither does my grandson. So there's a lot of disparities when it comes to that monthly income. You know, when you're a single mom with a child and you live paycheck to paycheck, there should be some type of leeway or flexibility with that. Especially that you're a single parent, you're a single parent with a kid. You know, Here gratefully, right now Hennessy, she still has her insurance. My granddaughter still has her insurance. I have insurance, but I have insurance through my job. So I'm able now to get what I can when I can. Another thing that I wanted to add was when I was with Oscar, their co-pays when I used to go to the Diabetic Research Institute at was $125. So I went to see my endocrinologist every 3 months. So every 3 months I had to come up with $125 plus every month $279 for insulin because I'm a type 1 diabetic. I use an insulin pump, and gratefully I have the flexibility with the insurance that I have. But back then I didn't. When I was with Oscar, it was impossible. They made it difficult from the beginning, from day one. So
And even when you were uninsured, it was scary. I remember you were scared a couple times your sugar was going to get too high. You had the fibromyalgia. You had all kind of stuff going on when you were uninsured. Think about what Amy's just saying, folks, and what I said as a diabetic. Think about if you don't have insurance. That's why we're here today, too. If you don't have insurance and you're diabetic, how are you going to come up with that money for insulin? Yes, they lowered the price, but now they re-raised the price. They raised the price of the pump. They did all this kind of stuff. This is why we got to expand Medicaid, and not just in Florida, but the other states that didn't. So everybody has a shot at health care. Yes, some people are not going to have a shot at it. We understand that for different reasons. But if we get more people insured and more people in the system, the better everyone will be and healthier everybody will be and more lives will be lived. Amy shouldn't have had to beg for care and give Jen, her daughter, Claritin and cough syrup for 4 years. Okay? She shouldn't have had to do this. And this girl has one lung missing, part of one lung missing. Amy shouldn't have had to beg for care. I shouldn't have. Nobody should have been begging for care. Yes, the J2 card works, certain cards work, but not everybody in Florida has that level of care in this state. Rural hospitals are closing. If the hospital's closed, then what? That's why we have to expand Medicaid. So, Amy, I want to thank you because you answered the question perfectly without me even asking you. Why is healthcare important to you?
I wanted to let Devin know my daughter had surgery at Jackson when she was 17, and I can't complain. I mean, you know, I went through a lot of resources for my diabetes care. There's a lot of nonprofit organizations out there who are made to help people like myself, like you, Fred, like Brian. Camilla's House is one of them, but at that time wasn't aware of Camilla's House, and I didn't know that their level of assistance was to that extreme. If I would have known that they were going to be able to assist me with what I needed, I would have reached out to them. But I went through a lot of other nonprofit organizations that currently exist, and throughout a whole entire year, there's one specific one, Maya Beatties. Um, I mean, I wish they were in Miami because they're based out of California, and Maya Beatties is a nonprofit organization that you fill out their form on their Instagram page. They have a link. You fill out their form, and the form asks what you need and how much, if you have any, how much you have. If you have insurance, if you don't have insurance, it's a way where it helps you. And they helped me through the whole entire year that I had Oscar. They helped me with pump supplies, insulin, glucose supply, sensors. They helped me with supplies for alcohol wipes, syringes, pen needles, anything that you need. They, if they have it, they send it, and if they don't have it, then they use connections with other patients or other volunteers who may have it and can send it to you. And I didn't have to pay a dime.
And I'm
My
I'm glad
aunt,
you I'm glad you said that, Amy, because I was going to ask you what resources did you use? Because and I'm sure you don't know, but I'm type 2 diabetic with a component with a type 1 component, right? So even when it came to supplies, even with me being insured, I would use different websites. I don't know the websites, off the top of my head, but I would use different websites, with Google, certain things like I'm currently on Himalog. Also I used to be on Ozempic, but now I'm on Manjaro. I also take Farxiga, that's once a day, and I also take Lantus, and I take Lantus 15 units at night, and my Himalog I take uh, at least 10 or 15 minutes before each meal, right? So with that being said, I would use different websites and just Google for certain discounts, and certain websites, would just give you whatever you need sometimes for free or something like that.
do you
And
use I'm sorry to interrupt you, Devin.
okay.
Do you use Dexcom?
Um I use, yes, I'm on, yeah. Yeah, actually I got a Descom on right now. I had
Okay.
another one, but
So
I use Descom.
you know that Dexcom has a patient's assistance program.
Okay.
Okay, and that's how I was getting my sensors when I was with Oscar because I couldn't afford to pay for them.
Hmm.
So Dexcom has a patient's assistance program. They have also, you go into their page, you go into pay Dexcom patient's assistance program in Google. It'll take you to the page, you fill it out, and then it'll ask you to submit proof of income. It'll ask you to submit certain requirements. Everybody's different. So with me, it was proof of income. Um, and I sent them my proof of income, and they covered my sensors for 6 months
Hmm.
for a 3 months period, and all I paid was $45
Right. And
for
so
nine sensors.
that's currently what I pay. That's currently what I pay now, in terms of copay. And I know Fred, kind of asked how do we kind of relay these messages, to, patients and stuff. And it's through conversation, like what we're talking now. Like a lot of people don't know about, different resources, and just,
Right.
giving that information out there. When in terms of Medicaid, this whole Trump thing, I'm assuming this is what Trump wants. He wants to get
Right.
rid of this Medicaid. And that's going to be a problem on the people who are insured, us. You
Right.
know, at some point, it's called uncompensated pay. And if
Hmm.
these hospitals are closing, um, our premium, is going to go up. Our co-pays are going to go up um, to kind of pay for, people who are uninsured. So when people come to the hospital now, and if this whole, taking away Medicaid thing happens, we're going to be the people who are insured. We're going to be the people who are at fault. We're going to, it affects everybody. So if I'm currently paying what, $25 for a ER visit, the $25 may go to $75. It
Mhm.
may go to $100, so just being aware and sharing the information with everybody, kind of helps everybody out. That makes sense.
Yeah,
Devin, thank you so much.
I
You
I
brought,
have a
you
lot of
brought,
I mean, I know of a lot of resources that are available.
Yeah.
Um, they're the resources that helped me out throughout the whole entire year that I was with Oscar. And to this day, they still helping me out because, for unfortunately, the insurance that I have now, there are certain things that they don't cover. So I've had to reach out to, Tandem, Dexcom, Omnipod. I've used two pumps so far that, you know I'm religious to, which is Omnipod 5 and the Tandem T Slim. So I go back and forth because, unfortunately, the insurance that I have now, they don't cover anything that pertains to Tandem. So I had to go back onto Omnipod, which is what I'm on now.
Okay.
So it's not easy.
Hey, Devin, Amy and Devin, I want to thank you both. I got to keep it moving. I want to welcome our next guest on if she's available to speak. Tawana Akins, my dear friend, if you're able to speak, we answered a question in the beginning. Why is healthcare important to you? If you can answer it real quick, please. If you're able to, if you're not, it's okay. Okay, I guess she's not available. Okay, we're gonna
Yeah,
pivot
Fred,
now.
I'm still at work, Fred. So I'm
Oh,
here,
I'm
but I
sorry.
can't talk right now.
Oh, I'm sorry. Okay. Thank you for supporting at least being on. Okay. I'm
Okay.
sorry. Okay. Okay then. We're gonna pivot forward. I'm gonna bring on Anna Christina now. Uh First I want to ask one question to each of you that spoke today. Why is Medicaid expansion important to you? Why is it important for Medicaid expansion is important to you? And why is it important to you? Devin, would you like to go speak?
Give me 1 second, Fred. Hold on. Fred, pass me up really, really quick. Somebody's at my door.
Okay, no problem. Miss Joey, could you come on for a moment and just answer why Medicaid expansion is important?
Fred, why is it so important?
Yep.
Because it's 800,000 individuals. We need
Right.
800,000 signatures, right? In order to
Yes.
put it back on the ballot.
Yes. Yes.
And that's why the petitions are needed. And because it's going to increase, I think Adele said that it's increasing 75% with Obamacare, with the new changes, and that, you're talking about the co-payments now, but it's going to be extremely higher if we don't take action now. And I'm complete.
Thank you for that so much, my dear friend. Uh, Amy, I'm going to ask you, why is Medicaid expansion important to you?
Medicaid expansion is important to me because Florida has too many people without health insurance. Um, I, as many of you know, right now, the tax credit that gives everybody the opportunity to get marketplace insurance, it's on the chopping block. And if that credit is cut, all those premiums from all of those insurances are gonna be even higher than they are now. If we as a humanity, we as humans can't afford the insurance that they provide for us now that we have to pay a copay every month. Imagine if they do the tax cut for it. There's gonna be millions, millions, especially the Hispanic population, because the Hispanic population on depend on that. They depend on marketplace insurance. You know, so for me, it's important that Medicaid gets expanded because, like I said earlier, health insurance is not a luxury. Health insurance is a basic human need. And as our generation gets older, we become sick or have conditions or have ailments, like, you know everybody's body's different. But as we get older, without insurance, it's going to be difficult for us to stay healthy. And if we want a healthy workforce, then we need health insurance.
Thank you so much. Would anyone else like to chime in before we go to the next segment with Anna Christina before we log off? Susan, are you still there? Would you like to say anything else? Let me check and see if she's still there. Oh, okay, she left. I didn't even realize she left. Okay. So, okay, folks. Anna Christina, I'm sorry it took so long, but we had such a powerful discussion. Let me bring along for you guys. I've told you about this nice lady. Her name's Anna Christina from Florida Decides Healthcare, which is the organization doing the ballot initiative tonight. And she's going to tell us about the petition, how to fill it out properly, also how many signers we need, and how to get the petitions. Anna Christina, it's your floor now, please.
Awesome. No worries, Fred. Hi, everybody. Like Fred said, my name is Anna Christina. I am the organizing director for Florida Decides Healthcare. D. Ray, who's one of our fantastic organizers, is also on the call in case there's questions that he can help answer. Like Fred mentioned, right? Like, this is one of those very everybody wins situations. We will get 3.7 million people access to healthcare and save the state some money, and really just help stop a crippling healthcare crisis that is going to hit the state when the tax credits lapse and folks go to apply for healthcare and realize that they are no longer eligible or able to afford it, right? So that's like the big picture of it. As Fred also mentioned, the state of Florida never makes anything easy, and they have passed a law in May called HB 1205. What HB 1205 does is make the petition collection process harder, and certainly costlier. And so we have had to do a pivot to a distribution method. What this means is essentially, because of the law, we are asking volunteers that instead of collecting petitions the way we have done historically for a number of issues, for restoring rights, for minimum wage, for all that good stuff, abortion, last cycle, we are instead just giving them the petition and an envelope. That is the essential piece, is that we cannot actually take back the completed form. All we can do is provide it to folks and provide them the envelope so they can mail it in themselves. These envelopes, which I can happily mail to anyone here and anyone else who would like them, are pre-addressed and pre-stamped, so you don't have to worry about putting postage or any of that stuff. My best practice is always to have the folks fill it out in front of me. Like, if ever administration where I'm able to, I will still have the petition on a clipboard, have everyone fill it out completely, and then once they finish out, provide them with the envelope. And if there's a mailbox nearby, ask them to drop it in that mailbox. If there's not, ask them to put it in their back pocket and drop it in their mailbox when they get home. That has been fairly effective, and that is what we're pushing at this point. I'm going to put the link in the chat for our link tree. This has all of our useful links, including, by the way, the link to share your story. A few of you on here have shared very powerful healthcare stories, and we know that those stories are really essential for this issue, to explain to folks why healthcare is such a crucial thing. Most of us are fairly empathetic people, and we feels very common sense to say, yes, of course, people should have healthcare. But for the folks that don't, being able to humanize the issue with real stories is an important part of our campaign. So we are about 200,000 petitions collected. Obviously, we need a lot more, but we're going to keep on pushing here, and certainly appreciative of all of your help. Happy to take questions as well, or if there's anything else in particular you want me to cover, Fred.
Okay, can you tell them how the certain organizations like my friend Tawana with a Better Me / Community Collaboration Exchange, Miss Joey with Community Collaboration Exchange, and also with the Collective Sisterhood, how they can join the coalition as partners?
Yes, absolutely. I'm putting my email for you here in the chat. Really, all you need to do is let me know you are interested in joining the coalition. I just always prefer it in writing so that I have a record to go back to. And, we're balancing a lot of things here, so it's just helpful to have that email. If you send me an email, let me know. We will happily get you out some petitions and have you join our grassroots call. Our next one is this coming Monday at 6:00, and we do those every other week.
Okay, because we have kind of conflicts. Some of them can't join you all the time because some of them have other obligations. Like I was asked to do a healthcare call next week, and I'm going to be doing a call with my partners on a Zoom. So, we have kind of conflicts because we do weekly and monthly Zooms for certain days, certain times, unfortunately. But is there a way they can still follow this even if they're not on the Zooms?
Absolutely, yeah. I always just recommend getting on the emails because I will always send out a recap from the meetings. So even if you're not
Okay.
able to join the grassroots call, you'll get the slides and you'll get a nice recap email.
Okay, great. That's going to help them a lot. So, I'm going to open it up to questions. Miss Joey or Amy, do you have any questions for Anna Christina?
My question for you is, how positive are you that the people who you're giving these petitions and that they're filling them out and that they're filling them out properly? How positive are you that they're going to send them back?
I mean, it's never a guarantee, and we know that. That's part of why we use share mail so that we can actually have some level of tracking as to how many envelopes we're getting back. We can't guarantee that, right? But I will say we have certainly been able to see a lot to make sort of mitigate the folks that like lose it in their purse by having them drop it in a mailbox at the location. Whenever that is possible, that works really great. For example, we work with Faith in Florida, and they drop it in the mailbox as they're leaving the church, right? Obviously not always an option, but when we do have that option, that has worked really well.
So there are hubs where if they can't drop it in the mailbox, they can drop it there, or
No,
no?
they have to drop it in a mailbox. Unfortunately, with the change in the law, we as volunteers and even us as staff can't collect. Like that's the biggest thing is that we're not allowed to collect without being registered circulators. And there's a lot of reasons why we don't really want widespread regular petition circulators. Basically, it ties the form back to you and potential fines and fees and all that good stuff. So we're just doing this instead. Not great, but it's the best option we have basically. And frankly, it's what we did when voter registration got tougher. Like that was pivot there.
I mean, for me personally, I think that it's just a way for the state to kind of do a control thing by creating a law that number one makes no sense. Number
Oh,
two, we have a
absolutely.
governor. Number two, we have a governor who makes no sense either. So he's making these laws and establishing laws and signing these bills and this and this and that. You know, now with the new thing with the vaccines. Okay, so that's the big thing now. You know, my thing is for all those parents who choose to vaccinate their children and have health insurance is not going to cover vaccines. Their parents are going to have to dish out of their pocket if they want their child to stay healthy and in the school system. That's going to be the new thing. And this is
I agree
something
with
that
you.
this is something that I really, really wish parents and that they realize that by them doing this anti-vax or no vax or you're not mandated to vax, you're not you're not doing anything glorious. What you're doing is you're causing a danger. You understand? You're causing a danger because I have a 8-year-old grandbaby that goes to school with other kids. You understand? Gratefully, my granddaughter's vaccinated because her mom makes sure that she goes to her pediatrician, gets her vaccines, whatever, whatever. But what about the kid that's sitting next to her whose parent is anti-vax and is not vaccinated? That doesn't prevent my granddaughter from getting measles, mumps, rubella, polio. It doesn't prevent her from getting it because she's vaccinated and the other kid is not. It still makes her susceptible to getting it. And this is something that all parents should really take account and really like make a big deal out of this. The same way we're making a big deal about Medicaid expansion, we need to make a big deal out of this as well. Because for those parents who have Medicaid, or those children who have Medicaid, when it's time for vaccination, Medicaid is not going to cover them because the state is not going to regulate them. Parents are going to have to come out of their pocket to pay for them if they want their child to remain in the school system and stay healthy. So this is something that by us, by doing the ballot and pushing it, you know, there's other things behind it that should be pushed as well, not just
Right,
Medicaid expansion. You know,
right, exactly, exactly. In other words, like I said earlier, to Devin. We fix the system. We get this Medicaid done first. Then we expand and we fix the system. All the problems like you have with copays, all that stuff, it gets addressed at every level, the Medicaid level, the Medicare level, the ACA level, the private insurance level. Then the problems get solved because then you see where everybody's at and what the major problems are. Once you get everyone in the system, which is a huge need still, and there's some people I know that don't want to be in the system. They want to live off the grid. They want to do this, this, and this. Sorry about the tirade, but I understand that. And there's folks that don't believe in healthcare, unfortunately. But uh, 99% of us, I believe, do and want this. I think Anna Christina, what is it polling? 70% of people right now favor it in Florida.
Yeah, so the even our most conservative polling, I mean, like we made it really specifically conservative with the idea that it's like the worst election we have ever. Even then, 67%. Our
Which
ceiling
is
is
enough to get it across the
74%.
ballot.
Yeah. Our
Okay.
ceiling is 74% support. That's 50% Republican and higher above pretty much every line. Like there's not a demographic group, there's not a geographical area that does not support this because it
I
really is
mean,
common sense.
who in their right mind would not? I mean, this is the thing that used to bother me doing this for now 12 years. I used to pound my head against the wall, and Amy can tell you this. I could never figure out how to reach these people to make them understand how important this is. I mean, you've got sick people that need medicine, sick people that need to see a doctor, and sick people that need to go to a hospital. It's sick not to treat them like this. I mean, it really, honest, forgive the soapbox, but it's the truth. It's sick. I mean,
but it's
I'm grateful. I could have walked away once I got my health care, but I didn't want anybody else to walk in my shoes. That's
you
why I'm here
also,
tonight. That's why I'm trying to get
Fred,
people involved in this process.
you also have to keep in mind it's not just about all of those who are sick or have a pre-existing medical condition. You also have those mothers or those mothers with young children, minors under the age of 18, who don't qualify. And then the system, because the mother doesn't qualify, the system automatically kicks off the child. I have one of
Mm-hmm.
those in Texas. And then you also have to remember, Medicaid expansion is also going to protect those future mothers, or those the young adults that are coming up now that become pregnant or have kids, or I think that you know insurances shouldn't have a cap on age. You understand? Even if it's an insurance that you pay. For example, I work for the county. I work for Miami-Dade County. My insurance is AFMED, and my insurance has a cap on the age of my kids if I wanted to register them under my insurance. I don't think there should be an age cap. You understand? If I'm paying for this insurance, every month, which would be $120 a month, and I can add Tom, Dick, Harry, John, Peter, Paul, and who else, even the dog, for $120, why have an age cap? You understand what I'm saying? So Medicaid expansion, they should, there shouldn't be an age cap at all. Not even
Of
on
course.
Medicaid, because Medicaid has an age cap. Medicaid, once you turn 18, 19, if you're still a student, okay, has an age cap. Once you turn 18 or 19, after that, they cut you off.
Right.
Unless you get knocked up and you become, unless you get knocked up, to say it, unless you get pregnant, because that's what they told my daughter, you know, unless you get pregnant, and then you start with the prenatal care, and that's where the Medicaid jumps in, that you will automatically qualify. But not everybody wants to get pregnant. You understand?
Right.
And
Yep.
I can tell you, because I've had my back and forth with DCF over Medicaid all these years, and Fred knows, you know, that their standards and their system is so broken that it doesn't work.
Right. 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 So, I want to open it up. Does anybody else, Joey, Tawana, Devin, any of the interns, do any of you have any questions for Anna Christina?
No, I have no questions at this time. Just thanking her for coming on and explaining some things to us.
Okay, great. Let's see. We think Joey just texted me something. Let me just see what she said. Okay, great. Great, guys. I want to thank you guys for coming on. I just want to see if anybody else, let me think who else is coming on. If anybody else wanted to add anything before we close this out for this great, powerful hour and 14-minute meeting, which I'm grateful of, which will be recorded, which will be on. Wait, oh, I hit the button. Again, I want to thank everybody for this great, powerful meeting, which will be on Zoom, which will be on YouTube after we're done, which you guys can watch. I want to say this. Anna Christina, how many petitions do we have signed totally? Do you have an estimate right now?
So we have over 200,000 collected. One of the challenges with HB 1205 is that we don't actually have a full count, because there is currently a moratorium. So from July until the end of this month, the SOEs are actually not validating any petitions. So we won't really have an accurate accounting until realistically like late October, November, but that's our best estimate at this point.
So what is the plan? I'm going to ask this real hard, tough question. What is the plan going forward? I know February 1st is the deadline, correct?
That is correct, yes.
So we have to get an estimated maybe 700, 800, 700, 800,000, depending on how good we did the past 3 months with these petitions by then.
Correct. Yeah. One of the things is we're putting a really strong emphasis on the mail program. So we started running a mail program, sending it to likely supporters with the prepaid envelope. That's A, super cost saving, and B, a really efficient way to do it. So we just did a pilot of that yielded some really good results. So that is really what the pivot is going to be at this point.
Okay, because we're just, I want to be doing another Zoom like I told you. I'll send you the link for come on the 25th this way, because there's a few people I'm going to have as panelists to speak. We're going to do healthcare and gun violence as a discussion. We're not going to do, what I just decided tonight, we're not going to do a traditional meeting like we did. We're going to have a discussion on this.
Okay.
We're going to combine both issues and see how they work.
Sounds like a plan.
And I wanted to have you come on, and anybody else from the great organization you work with to come on and discuss with us, because this is, I think we need to have a discussion as activists and community leaders to see where everybody's at, because we made some really powerful points today, on this. I'm really surprised at what was going on. This was mainly just to get the petition done, as you know, but we made some really powerful points about where we need to go from here once we get this done. But it also supports the argument for why we need to have Medicaid expanded. In other words, people having problems with copays. If we have everybody in the system, the copays are going to go down. It's a proven fact. And even the co-pays for the ACA people, everybody. I mean, my dad went to the hospital a couple months ago, and he got a bill for like, I think it was like $500, and he's questioning the bill. He's trying. It's not that it's a lot. It's not that it's a lot of money, but the principle was he's saying at 80 years old, why did they charge me like I forgot. He said $200 for IV saline that cost $10. In other words, people don't understand the dirty little secret. Hospitals are charging more money to pay for people who don't have health care. And if the low income pool, which is the hospital charity program, goes away, we're going to have more sick people dying, which is another reason to expand Medicaid. Sorry to be morbid about it. Okay, I want to introduce to you Anna Christina. This is Shakita Days from the Dark Days Foundation. She does gun violence prevention and also a little bit of healthcare. She's also a health insurance provider and life insurance provider. Shakita, I know you're late. Can you introduce yourself real quick if you're able to Anna Christina? Tell her what you do, please. Okay, I guess she's probably still at work. So, okay, guys, I'm gonna. Okay, I'm gonna. Let me just check and see if she's going in the chat real quick before we sign off. Oh, I love what she said. She said, every event we do, pass out the petitions. Thank you, Shakita. We intend to. We need to get this in every church. So I'm going to encourage everybody on the line. Please tell your pastors to, even if you have a church of 12 people, if it's 100 people, if it's 200 people, please get your pastors involved. Please also get them done. Violetta, I want to ask you, do you have any questions? This is Violetta, who's one of Miss Joey's interns. She's a social worker intern from Barry University. Violetta, do you have any questions for Anna Christina or any of the panelists before we go?
Well, I don't have any questions so far, but I heard your input about this insurance stuff that I don't like it, but it's still, it's something that is stick to us, to all of us, right? And really, I understand that it might be so hard for many people and families. Thank you so much for the information.
Okay. Okay, thank you. Thank you. Okay, guys, I want to thank everybody for coming on tonight. And we got to, right, Shakita, we do have to follow up. They will follow up. Anna Christina, please reassure her, because she said that in the chat, Shakita pointed out, people need to they have to be followed up with on, whether the petitions are being signed.
Yeah, absolutely. I mean, certainly anytime we're handing them out, we are encouraging that follow up. And we're trying to make, again, as easy as we can make it for folks. If they can drop it in a mailbox right then and there, even better. If they can't, then hopefully they'll drop it off at home. But yeah, the follow up is a crucial piece here.
Okay. Okay, I want to thank everybody for coming on. We will see you for the Florida Summit on the 25th. If anybody has any questions, I want to let it go for another minute or two. Please let me know before we sign off.
Thank you, Anna Christina, and the rest of the guests. Very informative. Great job, Brad.
Thank you, Tawana. Do you have any questions for her, or well, you'll email her. I know you'll email her. Oh, Tawana, before I forget, can Anna Christina join us on our chat this way, some people on our Zoom on the end of the month, please?
Sure.
Anna
Sure.
Christina, Tawana's going to give you the information for it. We do a community collaboration exchange meeting at the end of the month, which is several community leaders, activists, artists, politicians, doctors, etc. in this group. It varies upon who's available during the day, and pastors too. And we would like to have you formally invite you to join us. What is it, the 27th or the 25th? What day is it again, Tawana?
The last Sunday of the month. I don't have the date in my head, and I'm driving now. I just left the school.
That's okay. Sorry, it's okay. It's okay. It'll be the last Sunday of the month at 6 p.m. Either you guys can connect through email, or I'll try to email you the link. Tawana, I still got the link. It still should be good for Anna Christina to use next month, right? For this month?
Yes.
Okay. Anna Christina, I'm going to try to email you this link for this when I get done. This way you can come on. I will email you the link for the 25th from next week. I want to thank everybody for being great guests, great participants, and great reporters. We were going to have a great discussion on the 25th. I'm hoping some more people that were supposed to come on good. And we're looking forward to the in-person on the 8th of November. Thank you all and God bless. I'm going to end the
All right.
recording.
Thank you all.
Good night, everyone.